Ever heard of frozen shoulder? No, it's not a winter ailment but a common medical condition. This intriguing term refers to a condition officially known as adhesive capsulitis. It's a health issue that's as unique as its name, characterized by stiffness and pain in your shoulder joint. Picture your shoulder. It's a pivotal element of your body's mobility, allowing you to reach, lift, and perform countless daily tasks. Now imagine that freedom of movement hampered by a gripping stiffness and persistent discomfort. That's the reality for those dealing with a frozen shoulder. It's a condition that can sneak up on you, gradually worsening over time. And in severe cases, it can lead to a significant loss of movement in your shoulder. And it's not just about physical discomfort. The impact on daily life and activities can be substantial. So what causes it? How can you recognize it? And importantly, how can you treat it? Stay tuned as we delve into the causes, symptoms, and treatment of this intriguing condition. What causes one's shoulder to freeze? Let's find out. Frozen shoulder or adhesive capsulitis is a somewhat mysterious condition. The exact cause is often unknown. However, there are several factors that can contribute to its development. One key factor is inflammation. The shoulder joint is surrounded by soft tissues that can become inflamed due to various reasons, such as overuse or injury. This inflammation can cause the shoulder capsule to thicken and tighten, restricting its movement and leading to a frozen state. Speaking of injury, any trauma to the shoulder, such as a fracture or surgery, can also lead to frozen shoulder. This is often because people tend to avoid moving their shoulder after an injury to prevent pain. However, this lack of movement can result in stiffness and ultimately a frozen shoulder. Beyond these factors, certain medical conditions can increase the risk of developing a frozen shoulder. For instance, people with diabetes are more prone to this condition. This is because diabetes can cause changes in the connective tissues, making them more likely to become inflamed and stiff. Similarly, a stroke can lead to a frozen shoulder as it can limit the use of the arm, leading to stiffness and immobility. So, while the exact cause can be elusive, certain risk factors are well established. How do you know if you have a frozen shoulder? Well, your shoulder might just tell you. Yes, you heard it right. The shoulder speaks. It's a language of discomfort, pain, and limitation. A language you wouldn't want to become fluent in. One of the first words you might learn in this unfortunate language is pain. Frozen shoulder typically begins with a dull or aching pain in the shoulder area. This pain may be mild at first, but as the condition progresses, it can become more intense, sometimes even sharp. Another term you'll likely come across is stiffness. As the name suggests, a frozen shoulder becomes increasingly stiff and unyielding. You may find it difficult to move your shoulder or arm, and performing everyday tasks like reaching for something on a high shelf or fastening your seatbelt can become a challenge. Next in line is a phrase that's perhaps the most telling: a limited range of motion. In the early stages, you might only notice this when trying to reach behind your back or lift something heavy. But as the condition worsens, you may find that your shoulder's range of motion becomes significantly restricted, making even simple movements a struggle. Now, these symptoms can fluctuate throughout the day. Many people find that their symptoms are worse at night, which can make it difficult to get a good night's sleep. Cold weather can also exacerbate these symptoms, making the shoulder feel even more stiff and painful. So, if your shoulder is speaking this language of discomfort, don't ignore it. Listen to what it's trying to tell you. Are you experiencing persistent pain, stiffness, and a limited range of motion? If so, it might be time to consult a healthcare professional. Remember, the sooner you recognize these signs, the sooner you can get on the path to recovery. So keep an ear out for what your shoulder might be saying. After all, it's not just talking for the sake of it, it's reaching out for help. Understanding these symptoms is the first step towards seeking effective treatment. A frozen shoulder doesn't need a thermometer for diagnosis, but it does require a keen eye. Let's talk about how doctors diagnose frozen shoulder. The diagnosis process is heavily reliant on a thorough physical examination, coupled with an understanding of the patient's symptoms. During the physical examination, the doctor will ask the patient to move their arm in certain ways to check for pain and evaluate the range of motion. This process is often referred to as a passive range of motion test. If you're wondering what that means, it's quite simple. The doctor moves the patient's arm and the patient relaxes. This helps the doctor determine if the shoulder joint itself is causing the restricted movement. Now, this might surprise you, but the diagnosis of frozen shoulder is primarily based on the symptoms and this physical examination. The doctor will also consider the patient's medical history, taking into account any injuries or conditions that could contribute to shoulder stiffness. However, in some cases, the doctor may order additional imaging tests, like an X-ray or MRI. These tests are not to diagnose frozen shoulder per se, but to rule out other conditions that could cause shoulder pain and stiffness, such as a torn rotator cuff or a bone spur. Remember, a keen eye and a thorough understanding of the patient's condition are key in diagnosing frozen shoulder. A correct diagnosis is crucial for an effective treatment plan. Frozen shoulder might sound chilling, but its treatment options can bring warmth and relief. Let's dive in and explore these options. The primary aim of any treatment is to alleviate pain and restore normal range of motion. The route taken to achieve this can vary from person to person, depending on the severity of their condition and their personal health status. Physical therapy is often the first line of defense. A physiotherapist instructs you on exercises to improve mobility and flexibility in your shoulder, gradually helping to stretch the shoulder capsule. These exercises may be challenging and uncomfortable initially, but they're designed to get your shoulder moving again. Persistence is key here. Medication is another commonly used treatment. Non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen can help reduce inflammation and pain. In more severe cases, a corticosteroid injection directly into the shoulder joint can provide rapid relief, though this isn't a long-term solution and repeated use can lead to side effects. If conservative treatments like these don't bring relief, it might be time to consider surgical options. Manipulation under anesthesia involves the doctor moving your shoulder to break up the adhesions while you're under anesthesia. Another option is arthroscopic capsular release, a minimally invasive procedure where the surgeon cuts through tight portions of the shoulder capsule using small instruments inserted through tiny incisions. It's important to remember that early treatment is crucial in preventing long-term complications and disability. So, if you're experiencing symptoms of a frozen shoulder, don't hesitate to seek medical advice. Finally, remember that treatment doesn't end with surgery or medication. It's a process that involves commitment to physical therapy and lifestyle changes. It may be a long journey, but with patience and perseverance, you can regain your shoulder mobility and return to your normal activities. With the right treatment, a frozen shoulder can thaw over time. Prevention is better than cure, even for a frozen shoulder. This age-old adage holds true, especially when it comes to our physical health. For conditions like frozen shoulder or adhesive capsulitis, preventive measures can play a significant role in averting the onset of this debilitating condition. One of the most effective preventive measures is regular exercise, particularly those that focus on shoulder mobility. This doesn't have to be anything strenuous. Simple exercises such as arm circles or gentle stretching can do wonders in maintaining the flexibility of the shoulder joint. It's about keeping the shoulder muscles active and engaged, preventing them from stiffening up and losing their range of motion. Maintaining a good posture is another preventive measure that cannot be overstated. Slouching or consistently hunching over a desk can put undue stress on the shoulder joint, potentially leading to frozen shoulder over time. So remember to keep your back straight and shoulders relaxed, especially if your daily routine involves prolonged periods of sitting or standing. Let's quickly recap what we've covered in this video. Frozen shoulder is a condition that affects the shoulder joint, causing pain and stiffness. It commonly occurs in people aged between 40 and 60 and is more prevalent in women than in men. The exact cause remains unknown, but it's often associated with a period of immobility due to injury, surgery, or illness. Symptoms include a gradual increase in pain and a decrease in the range of motion. Early diagnosis is key, typically involving a physical examination and imaging tests. Treatment options range from physical therapy and medications to surgical intervention in severe cases. In the end, remember, awareness and prompt action can keep the chill of a frozen shoulder at bay.